Dear students, as part of issues related to elderly, in this module we will be covering the health aspects of elderly. As we all know that as age advances, the health problems also increases. In that sense, one of the important issues the elderly confronts is their health problems besides the other social, psychological, economical and other aspects. So in that context, we need to have a focus on what are the health problems of the elderly, how are the things from the government and from NGOs and from community, what are the aspects that requires attention, especially when we are talking about the aging phenomena in our society. The biggest achievement of the century is no doubt longevity. All over the world, life expectancy has started rising. Growing population is one of the most significant characteristics of the 20th century, and the first quarter of the 21st century is going to be called as the age of aging. The alarming situation is that the world's elderly population is increasing day by day, and in this process we call it as population aging. Geriatrics is the branch of medicine dealing with the physiologic characteristics of aging and the diagnosis and treatment of diseases affecting the elderly. In most of the countries in the world, including India, the cutoff point for geriatric age is 60 years. The aging of populations thus demands a comprehensive health response. What are the health issues that confronts the elderly in our society? People become more and more susceptible to chronic diseases, physical disabilities and mental incapacities as they grow older. Majority of them refrain from seeking medical aid from public hospitals due to many impediments besides lack of money. As we know very well that though the public health system is existing at various levels, starting from community level, sub-center level, primary health center level, community health center level and at a district hospital level, no doubt the public health system is very responsive and also has been presented very systematically over a period of time. However, the quality of care provided in these public hospitals and health system responses are very poor, to the extent that it is not only for the elderly point of view, because most of these health system is in response to all the age groups of population. There is no separate public system especially to target only for elderly population. That is why elderly population have to compete along with the general population while seeking the healthcare services in these public hospitals. The idea that old age is an age of ailments and physical infirmities is deeply rooted in the Indian mind, and many of the sufferings and stresses within curable limits are accepted as natural and inevitable by the elderly. This is another dimension which we need to understand when we talk about health of the elderly. As soon as a health problems arises, it is accepted by the elderly people that this is the age to suffer and no need to seek any medical aid and support from the professionals or the doctors who are available in their area. Similarly, it is also important we need to understand the mindset of the caregivers, especially the young family members. They also feel that this is the age for elderly to suffer, and in the process they will also discourage them not to seek medical aid, and they themselves will avoid in taking them and referring them to various hospitals and healthcare services. This is one of the important aspects which contributes for their further health problems, which will cumulatively increases, which will lead to high morbidity conditions and also mortality levels. The differential aging phenomena, both physical and mental, appear to depend on several environmental social factors such as diet, type of education, adjustment to family and professional life, and consumption of tobacco and alcohol. They also contribute for the growth of the physical and mental capacities of any individual. This applies even in the case of elderly population. The existing medical facilities in India are highly inadequate and their utilization by the public is very meager. The problems these institutions face is more acute in the remote areas, where whatever meager facilities have been made available, they are not optimally utilized by the people. And in this context, when compared to young, magnitude and increase in reporting of ailments are comparatively large among the old. More than 1/3 of the total elderly, for instance, in one of the studies have shown that the elderly population reported ailments of whether it is in a short period of 15 days or for longer period of 35 and above hospitalization, the duration recall as against less than 1/10 of the total population. It can be easily understood the extent and the nature of health-seeking behavior and also the pattern of morbidity that exists among the elderly population. Also, we need to understand that there is a high and rising incidence of chronic conditions coupled with low rates of hospitalization that brings out the possibility that a fraction of old are living in pain and with little access to healthcare facilities. The other aspect is increased reporting of ailments by the aging population cannot necessarily be considered as an indicator of deteriorating health condition of the population in general. It may as well be reflection of increased morbidity burden in the country, increased health-seeking behavior of the population, and those issues also needs our recognition. The demand for geriatric medicine and care is therefore expected to grow substantially in our society and generate greater pressure on the existing healthcare facilities in the country, given the population aging, through which there is going to be aging phenomena which is coming up in a big way. What are the health and functionality and mental well-being of the elderly? With advancing age, the proportion of elderly who perceive their health as poor started increasing. For instance, from the latest study, it showed that it has increased from 34% in men and 35% in women in the age group of 60 to 69 years to the extent of 54% for men and 66% for women in the higher age group of 80 years and above. It also indicates that there is a declining physical capability. About 4% of the elderly needed full or partial assistance to perform at least one of the activity of daily living. In the case of mental health, we need to know that there are certain sections of population among the elderly who have a high incidence of mental health problems. For instance, as high as 44% of the elderly, they were suffering from psychological distress, and the proportion was much higher when we talk about the segments of elderly population like women, widows and rural elderly as compared to their counterparts in this society. Home and community care clients are reporting chronic health conditions like diabetes, stroke, Parkinson's disease, cancer, angina, blood clotting problems, asthma and osteoarthritis. This is a very important. What are the specific common psychological problems that are experienced by senior citizens which we need to know in our society? For instance, depressions, cognitive impairment, death anxiety, insecurity, neglect by family members and suicidal tendencies are also reported through some of the studies that are there in our India. Furthermore, what is the extent of disability that elderly are experiencing? Estimates of disability in India, though suffer from serious data and conceptual issues, whatever studies have shown, for instance, National Sample Survey 58th round conducted in 2002 on disability survey indicate that much higher disabilities than those obtained during the health surveys is reported. Disability figures also differ between the two major data sources like NSS and census also. Furthermore, definition of disabilities is pathological in nature and does not consider functional disabilities as suggested by some of the authors. That's why the disability rate, if you look at among the elderly population, it is highly underreported, and because the definitions are narrowly seen and the nature of disabled conditions which are reported and considered in various surveys are also questionable, and that has to be seen from that point of view. An interesting observation among these issues are that there is this wide margin of differences in disability estimated from various rounds of NSS data. The prevalence rate of disability for all the elderly persons varies from 39% in 1995-96 to 6.92% in 2002. The estimates from 47th and 58th rounds, however, seem to provide fairly close estimates. That is why we need to know that the mental health issues, the disability issues, they are all reported at varying levels, and in that context, we need to improve the quality of data, and also the nature of data that it requires also needs special attention. What about self-rated reported health? What is its current levels and how relatively they are also reported? When you talk about self-assessed elderly health measures, important is that there are commonly used measures of elderly health like self-rated conditions, like current or relative, on the basis of a hierarchical scale including categories like excellent, very good, good, fair and poor. Similarly, the 52nd round conducted in 1995-96 collected health and disability data on a 5-point scale by separating choices like excellent, very good, good, fair and poor. In the case of 60th round of NSS conducted in 2004, however, they made several amendments and used only a 3-point scale. These are some of the important aspects we need to know, that how is the health status has been measured by various sources of surveys that are conducted. What about the determinants of this health status of the elderly? Especially, what are the socio-economic determinants? When we talk about that we know very well that health is strongly associated with the socio-economic conditions of the population. It is very important for us to know that economic conditions, social conditions, if they are favorable, it will definitely enhance the health status of elderly so that they become positive and also they will be involved in mainstream activities. A study on Indian health system, for instance, conducted in 2002 indicates that the poor have less access to health facilities in general and public health facilities in particular, leading to their poor health condition on the one hand and very high financial burden on the other. Similarly, World Bank in its study in 2001 clearly indicated that the incidence of disability is significantly higher among population of lower income social groups. So, we have to be very clear when we talk about that the correlates of health status in terms of poverty, social groups, education status, place of residence, they are all indirectly, directly influences the health status. That itself indicates how these determinants play a very important role in influencing the health status of elderly. What are the major issues in planning for elderly healthcare services? In that regard, some of the issues that are very important and needs serious attention of the policy makers, program managers and all those who are associated directly or indirectly in caregiving of elderly in our society. First and foremost is life course management, supportive socio-economic environment and healthy aging issues that needs our attention. Similarly, creation of physical and financial infrastructure to meet the growing needs of healthcare is another aspect that requires our attention. Similarly, what about the epidemiology of aging? Like for example, the disease pattern, the physiological conditions that the elderly populations are experiencing, the factors that influence this distribution are all very important for us because the lifestyles are changing, the socio-economic patterns are changing, the developmental issues are changing. In that way, the profile of the elderly are also changing. Given these changes, no doubt we need to correlate with various quality of life indicators Furthermore, with epidemiological conditions, how they are changing over a period of time. In that sense, the role of public health in prevention of ailments and disabilities is another issue that requires attention of the concern. The pathways of poor old age health due to unsupportive environment is another critical factor and needs serious consideration. Understanding the social context of aging, therefore, will be highly significant to devise ways for creating a more amenable atmosphere for the elderly people. What are the aging experiences and goals of public health strategies? If we categorize them, we will be very clear that the type of older persons to have a robust or demented or late stage of life or non-sentient frail. If we look at, for instance, in the robust, there should be the goal of public health should be the prevention of frailty and disability. In the case of demented, prevention of excess morbidity and excellent custodial care. Similarly, the late stage of life, especially in the oldest old, reduction of isolation, maximization of choices. In the case of non-sentient frail, environmental modifications to reduce task demand, rehabilitation to increase capacity by developing abilities. The way in which these studies have shown over a period of time clearly indicates that most of these studies are all at a piecemeal level or isolated cases conducted at a micro level. That is why the health issues, or even in the case of other socioeconomic conditions also, we are not able to generalize for major macro level picture to understand the issues of the elderly with a special focus, for instance, in the area of health. To counteract these issues, to have a strong database on elderly population, an effort has been done by building knowledge base on population aging study that has been sponsored by United Nations Population Fund, New Delhi. As this study was carried out in a major states of India, 7 states have been chosen and the survey was conducted in 2011. This study, which was conducted at a macro level, focused on various socio-economic and living conditions of the elderly population with the scientific data and also with adequate and clarity in terms of the scientific nature of inquiry in conducting such studies. The findings that have come up from this study have clearly reflected the poor socio-economic attributes of the old people, with most of them are economically dependent. Caste and levels of consumption expenditure were found to be affecting their health outcomes. The impact of household consumption expenditure and its levels on elderly health is not only positive but also found to be strong. The socio-economic determinants of elderly health clearly indicate that elderly with better living conditions and economic independence have shown better health outcomes, while those belonging to lower incomes or consumption groups, widows and economically dependents report a poor health status. It clearly shows that the socio-economic status has an important role to play in understanding the health status of the elderly population. Similarly, education is found to be playing a very important positive role, but living with spouse has a very strong positive impact on elderly health population. What are the attempts which are required to achieve the health status of the people? It is required that we need to expand public health to include the aging health issues. Creation of basic health infrastructure for older people in villages, rural areas and smaller towns is very priority basis we need to implement. As we all know that health infrastructure is very poor in rural areas and furthermore in remote and non-accessible areas. That is why one of the important challenges is how best we can create basic health infrastructure in those communities so that the elderly and other vulnerable groups who are living in these areas can benefit from in reaching out and get the access to their health issues. Another important is the promotion of post-retirement facilities and services, particularly plans to park retirement linked savings and post 60 and above age group health insurance policies. It's very important in this context to mention about the Rashtriya Swasth Bima Yojana RSBY, the scheme which currently is available to the entire below poverty families, irrespective of their age. RSBY may exclusively be made available to men and women and covering under the old age pension schemes. The planning for an old age health card along the lines of the health card issued under the RSBY may be made so that the elderly, those who are in need of that and those who fulfill these requirements can greatly benefit from these schemes. There is also a need for all stakeholders, including the international agencies, to promote research and enhance awareness on aging issues. Given this health situation, one of the important aspects is how best we can improve the measurement of health related issues among the elderly. As we all know, there are major two types of assessment of the health status. One is the direct measure, the other is the indirect way. In the case of direct, the anthropometric measures, for example, height, weight, body mass index, skin fold thickness, hip circumference, waist or hip ratio, they are all important measures that we need to use and strengthen in promoting research in the case of health issues of the elderly. Similarly, there are biochemical or lab tests like HB, urine, assays, and some of these methods also are very important. In the case of clinical methods like skin, eyes, nails, teeth, etc., have to be used to assess the health conditions of the elderly. The dietary evaluation is another method where 24-hour dietary recall, diet history or habits, food dietary and observed food consumptions, appetite, patient diet, etc. plays an important role. These are all some of the direct measures. What about indirect measures? Indirect measures are also many. For instance, the consumption food using food frequency questionnaires also plays a very important role to adopt it and assess through these methods to assess the consumption of food habits. Similarly, to evaluate incidence and prevalence of various diseases also helps in assessing the health status of elderly. Other important is consulting the diet and nutritional experts in correctly assessing the nature and health problems of the elderly. Another dimension which we need to know and strengthen is the counseling services, the physiotherapy, palliative care, and all these issues are furthermore important. In addition to that, we need to have a regular monitoring mechanism of assessing the socio-economic status of the elderly, as we all know that the socio-economic status also has a significant role in promoting the healthcare status of issues and elderly problems. So in that regard, we have to understand that older people with limited mobility cannot participate in the mainstream workforce. However, in developed countries, many older people are participating in labor force to meet their basic needs, though they are unable to make it up. However, they all play an important role in assessing the higher levels of health status among the elderly people. We also should focus about how is the response of the ministries, especially like Ministry of Health and Family Welfare, which is an important ministry that takes care of various policies and programs when we talk about health status of elderly and various healthcare programs that are required for the elderly population in our society. No doubt, national policies and programs for geriatric care, cardiovascular diseases, diabetes, cancer, they all have been approved by the ministry, and furthermore various programs and schemes are on the pipeline to focus on these issues by the ministry. The ministry also provides facilities for senior citizens like separate queues in government hospitals, and they are all encouraged by the government to see that the elderly and their needs and access to appropriate health system is also important. The other important dimension in mentioning about the ministry's role is two national institutes on aging one in Delhi and another in Chennai, have been set up exclusively to focus on aging issues. There are geriatric departments to the extent of 25 medical colleges that have been set up in the country. There are short-term courses on health promotion among elderly and caregivers are also worked out by the National Institute of Health and Family Welfare, New Delhi. What about special healthcare facilities that have been provided in various states like AIMS and other Delhi hospitals, states like Goa, Gujarat, Karnataka, Madhya Pradesh, Maharashtra, Rajasthan, Tamil Nadu, Uttar Pradesh, West Bengal. So most of these states started having a special emphasis on identifying and working out suitable programs and schemes so that a dedicated healthcare system works for taking care of the elderly. However, we have to, in conclusion, I would like to emphasize that these programs mostly they are urban based. What we require is how best we can promote the health status of elderly population, especially for those who are living in remote and rural areas. It is a huge challenge unless the public health system and all the other stakeholders associated with the healthcare programs of the elderly, they all come together and play their respective and efficient role, we will not be able to achieve. In that context, it is important that there is a positiveness among these stakeholders who are coming together and also expanding their programs so that more and more elderly population are benefited from various healthcare schemes in India.